Hi everyone, Eileen Bayer of the Fam here. Welcome to part 2, episode 3 on major depressive disorder in our mini mental health series. In today's episode, we are going to be covering the treatment of major depressive disorder and what happens when you stop some of the medications abruptly for this disorder. So saying that, let's get started here. Medications in psychotherapy are effective for most people with depression. Your primary care doctor and psychiatrist can prescribe medications to relieve symptoms. However, many people with depression also benefit from seeing a psychiatrist, psychologist, or other mental health professionals. If you have severe depression, you may need a hospital stay, or you may need to participate in an outpatient treatment program until your symptoms improve. And we're going to give you a closer look at some of the depression treatment options available. Many types of antidepressants are available, including some that I'm going to mention. Be sure to discuss possible major side effects with your doctor or pharmacist. Okay, the first one we're going to cover is selective serotonin reuptake inhibitors, better known as SSRIs. Doctors often start by prescribing an SSRI. These drugs are considered safer and generally cause fewer bothersome side effects than other types of antidepressants. SSRIs include citalopram, better known as Celexa, escitalopram, or Lexapro, Fluoxetine, better known as Prozac, Paroxetine, which is Paxil or Paxiver, Sertraline, which is Zoloft, and Vilazodone, which is Vibrant. Serotonin reuptake inhibitors, better known as SNRIs. Example of some SNRIs includes Cymbalta, Epixar XR, Pristac, Kizidia, and Benzema. Now the third type is atypical antidepressants. These medications don't fit neatly into any other antidepressant categories. They include Wellbutrin XL, Wellbutrin XR, Alpenzin, which is Forviver XL, Mitrazapine, which is Remeron, Trazodone, Trazodone, and Viroxetine, which is Trimex. As far as the Trazodone, I know a little bit about that because the VA prescribes that for a lot of Vietnam veterans that suffer PTSD. It is an antidepressant, but Trazodone with different people have different effects. For one example that I can give you on that medication is another friend of our Vietnam friend that we have. He can only take a tablet of 100 milligrams, so that'd be like a 50 milligram, and it knocks him out. Now, when my late husband took Trazodone, for it to help him, he had to take 3 100 milligram tablets for it to work. So each body, each person, it affects differently, but that's just a little information that I can tell you offhand through experience that I know about Trazodone. It does, what it does for the veterans that take it, they take it at bedtime. Well, actually about an hour before bedtime is when you're supposed to take it. And it will make you tired, but it stops the dreaming process because a lot of Vietnam vets with their PTSD will have nightmares. So this will stop the nightmares, and that's why it's prescribed to them. Okay, trilyptic antidepressants. These drugs, such as Imiprene, which is tropinil, nortriptyline, which is bivectacil, can be very effective, but tend to cause more severe side effects than newer antidepressants. So triclits generally aren't prescribed unless you've tried an SSRI first without improvement. Now, another type is called monoamine oxidase inhibitors, basically known as MAOIs. Now, MAOIs such as Parnate, Nardil, and Marplan may be prescribed, typically when other drugs haven't worked, because they can have serious side effects. Using MAOIs requires a strict diet because of dangerous or even deadly interactions with foods, such as certain cheeses, pickles, and wines, and some medications and herbal supplements. Selagline, which is better known as Emsem, a newer MAOI that sticks to the skin as a patch, may cause fewer side effects than other MAOIs do. These medications cannot be combined with SSRIs. And lastly, other medications. Other medications may be added to an antidepressant to enhance antidepressant effects. Your doctor may recommend combining 2 antidepressants or adding medications such as mood stabilizers or antipsychotics. Anti-anxiety and stimulant medications may also be added for short-term use. And another example of that, when my husband was on the Trazodone, he had to take, I'm trying to remember the name of it. I think it was diloxin. It's a small little pill that he had to take to help him with the antidepressant for the daytime. But he would take that during the day and the Trazodone at night. Now I want to cover about finding the right medication. If a family member has responded with an antidepressant, it may be one that could help you. Or you may need to try several medications or combination of medications before you find the one that works. This requires patience, as some medications need several weeks or longer to take full effect, and the side effects to ease as your bodies adjust. Inherited traits play a role in how antidepressants affect you. In some cases, where available, results of genetic tests done by blood tests or a cheek swab may offer clues about how your body may respond to particular antidepressants. However, other variables besides genetics can affect your response to medication. So knowing that, we're now going to go over the risk of abruptly stopping any medications that your doctor prescribes. There's a big risk if you stop medication before you're told to stop it, so don't stop taking an antidepressant without talking to your doctor first. Antidepressants are considered addictive, but sometimes physical dependence, which is different from addiction, can occur. Stopping treatment abruptly or missing several doses can cause withdrawal-like symptoms, and quitting suddenly may cause a sudden worsening of depression. Work with your doctor to gradually and safely decrease your dose. Never ever stop taking medication by yourself. Always discuss it with your doctor. Now, another thing we need to know is how antidepressants affect pregnancy, because that is important, because everybody can get depressed, and we covered postpartum depression. So let's go over it. It's not a lot of information on it, but I want to cover it so you know. If you're pregnant or breastfeeding, some antidepressants may pose an increased health risk to your unborn child or nursing child. Always talk with your doctor if you become pregnant or if you're planning to become pregnant. Okay, antidepressants and increased suicide risk. Most antidepressants are generally safe, but the Food and Drug Administration, FDA, requires all antidepressants to carry a black box warning. What this black box warning is the strictest warning for prescriptions. In some cases, children, teenagers, and young adults under 25 may have an increase in suicidal thoughts or behavior when taking antidepressants, especially in the first few weeks after starting or when the dose is changed. One example of things like that is the medication that can be prescribed to you to help you quit smoking. I think it's called Syntax. I remember when I wanted to quit smoking before I went to vaping, I asked my primary care doctor about it because I told him I wanted to quit. And that's when he informed me, because of what I went through as a childhood with depression and the loss of my late husband, he would not recommend it because there was a higher risk of suicidal thoughts or behavior with that. For anybody that had at any time depression, because as we learned in the very beginning of this series, once you get depression, it's not like something that is going to be gone. You know, you'll get depression one time in your life, but throughout your life, you'll have different episodes of it. So that's why they have that, because medications like Syntax can increase the risk of suicide or bad side effects like that. Anyone taking an antidepressant should be watched closely for worsening depression or unusual behavior, especially when starting a new medication or with a change in dosage. If you or someone you know has suicidal thoughts when taking an antidepressant, immediately contact a doctor and get emergency help. Don't wait. If you're taking medication and you're still having suicidal thoughts and it seems like it's a lot worse, contact your doctor immediately. Keep in mind that antidepressants are more likely to reduce suicidal risk in the long run by improving mood. The next thing we're going to cover is psychotherapy. And with that, that can help to a little bit, but we're going to go into it because I want to cover this also besides the medications. So psychotherapy is a general term for treating depression by talking about your condition and related issues with the mental health professional. Psychotherapy is also known as talk therapy or psychological therapy. And a good example of this is, forgive me for keep bringing veterans, but where my husband was a Vietnam vet and he was going through a lot of this, I can use him as an example because I have that knowledge. With Vietnam vets, they do have their psychotherapies, which is, they go into group sessions and they go in and talk to their counselor, which I've been to both with my late husband, and they do help. And with the Vietnam vets, it's not just that, it's a little other thing. But you basically, when you talk about it, even, when I went through something horrific during my marriage, I don't want to get into full detail, but I did need to go for therapy for it because it really greatly affected my sleeping, my relationship, how I handled talking to people. So I needed counseling and therapy. And I've learned talk therapy does help a great deal. It helps get it out into the open. The more you talk about it, if you go to like a rape crisis center, they have you go in group sessions and talking about your nightmares, about what it is, because the more you talk about it and the more you get it out of your system, the less it will affect you. And mind you, it's not always an easy thing to do. It's going to bring, in the beginning, it's going to trigger some things. It may trigger your nightmares. If you're a veteran, it may trigger your PTSD a little bit, but in the long run, it's always better. So that's a little bit about that. There's different types of psychotherapy that can be effective for depression, such as cognitive behavioral therapy or interpersonal therapy. Your mental health professional may also recommend other types of therapies. Psychotherapy can help you adjust to crisis or other current difficulties you may be going through. Identify negative beliefs and behaviors and replace